Hello everyone, my name is Tasso.
I'm Daniela.
And I'm Kim.
And I'm Virginia.
And today we're going to be discussing which method is best to teach students with autism. Our hypothesis states that is the method of applied behavioral analysis the best way to yield results in education and cognition for students with autism. Before we go through the methods of teaching students with autism, we must understand the definition of autism. The definition of autism is that it significantly affects verbal and nonverbal communication and social interaction, and is generally evident before the age of 3, and it adversely affects a child's educational performance. According to the U.S. Center for Disease Control and Prevention, 1 in 166 children are diagnosed with autism. In order to understand the teaching methods of autism, we must first understand what the definition of autism is. So what is autism? Autism is a disorder that significantly affects verbal and nonverbal communication and social interaction. It is generally evident before the age of 3, and it adversely affects a child's educational performance. According to the U.S. Center for Disease Control and Prevention, 1 in 166 children are born with autism. The impairments range from mild to profound and vary from child to child. According to the National Institute of Child Health and Human Development, there are 5 main behaviors that indicate the need for a doctor to evaluate your child for autism. They include if the child does not gesture by waving or pointing by the age of 1, if the child does not babble or coo by 1 year, if the child does not say single words by 16 months, if the child does not say his own 2-word phrases on its own by 2 years of age, or if the child has loss of any language or social skill at any age. The historic roots of autism started in the 19th century, where students with different learning disabilities were sent to state institutions for the mentally ill. It has been assumed that prior to finding of the pattern of indications now identified as autism, the people did live with the syndrome and were put together either with the mentally retarded or the insane. Around 1911, a Swiss psychiatrist named Eugene Bleuler was the first person to use the term. He used this term to describe a group of symptoms of schizophrenia. In the United States in the 1940s, researchers started to use the term autism to refer to children with social or emotional problems. Current opinions of autism greatly differ with some of Kanner's observations of his 1943 study on 11 children. However, many of his ideas are still essential to today's view. Methods of teaching students with autism include the floor time method, teach, and applied behavioral analysis, which is also known as ABA. Methods of teaching students with autism. The teach method. The teach method was developed by psychologist Eric Schopler of the University of North Carolina in the 1960s. It is used by many public schools in the United States today. The children use schedules made up of pictures and/or words to order their day and to help them move smoothly between activities. Children with autism may find it difficult to make transitions between activities and places without schedules. The finished assignments are then placed in a container. Children may use picture communication symbols, which are small laminated squares that contain a symbol and a word, to answer questions and request items from their teacher. The symbols help relieve frustration for nonverbal children while helping those who are starting to speak to recall and say the words they want. You can see images of a teach classroom and a schedule which show the teach method.
The floor time method is a comprehensive framework which enables clinicians, parents, and educators to construct a program tailored to the child's unique challenges and strengths. It often includes, in addition to floor time, various problem-solving exercises and typically involves a team approach with speech therapy, occupational therapy, educational programs, mental health intervention, and where appropriate, augmentative and biomedical intervention. It emphasizes the critical role of parents and other family members because of the importance of their emotional relationships with a child.
Applied behavioral analysis is a strategy that dictates class structure and daily routines. It combines behavior management, systematic instruction, generalization, and socialization to eliminate maladaptive behavior. This behavioral model helps highlight the developmental of speech, language, and social skills. Each student's strengths are evaluated to determine his or her personal needs. This method helps teachers provide an easy and structured environment for the growth and development of a student.
What you can expect in an ABA classroom between a teacher and a student.
All right, Tasso, so today, since we're going to do our activity right now, so looking at these pictures right now, can you show me a person? Can you show me a person in this picture? Very good, Tasso. High five. All right. All right. Can you show me something that you would eat? Do you see anything that you would eat? No, try again. That's okay. Let's try again. Something that you would eat. All right. Birthday cake, my favorite. Amazing. Good job. High five. Okay, let's try. Can you show me something that you would play with? A nice toy. Very good. High five. I think you're going to get some extra computer time. All right, last question. Do you see something that's very, very hot and bright? Something that you see every morning when you wake up. The sun. That's a great job. All right, you can get some extra computer time. Very proud of you.
The implication is that ABA is the best method. The pros and cons. The pros: helps develop speech, language, and social skills. It can be done in multiple settings: home, school, or community. The cons are some families cannot afford this kind of intervention and it is not available to them. Some people believe this program creates robotic children, not children who think independently.
Some case studies in ABA method are from Dr. Ivar Lovis, who conducted research involving 38 children with autism, 19 with the experimental group and 19 with the control group. These children who participated in an intensive behavioral intervention program based on the methodology of ABA. After 2 years, 47% of the children in the treatment group achieved normal intellectual and educational functioning with normal range IQ scores. In contrast, 2% of the children in the control group not receiving ABA achieved normal education. Other case studies used 4 students with delayed social interactions, play skills, and behavioral issues that were taught responses to what, why, and how questions. The study focused on 4 types of probes: storybook questions, natural context questions, spontaneous questions, and maintenance probes. Students were instructed each day for 10 to 15-minute sessions. Children were shown pictures and asked questions corresponding to each picture. When a correct response was given, praise was used as a reward. When incorrect responses were given, the teacher would model the correct response and question the student again. The study found that all students reached or exceeded the desired criteria. There were increases in responses, but students failed by 35% on meeting generalization criteria for storybook and natural context techniques when the visual was not present. Our observational study will include participants who will be randomly assigned to one of 2 classrooms from a public school. 12 students are going to be in the study who range from 8 to 10 years old. There will be 2 licensed special education teachers and 2 class aides. Classes will meet for 35 hours a week and the study will last approximately 1 school year. The classrooms will be set up in the same manner. Both classes will have evaluation procedures, teacher-made tests, observations, and academic work samples. The experimental group, ABA, will be the methodology. The control group will be the conventional teacher dictating method. We will directly measure behaviors and accomplishments using task analysis data forms, reinforcer inventory data forms, and frequency charts. After 6 months, a questionnaire will be given to the educators. The data will be objective, accurate, and based only on observable events. Data will be graphed and analyzed. Follow-up studies are limited in this phenomenon, but our group will have a paraprofessional keeping track of students after the study. Some of the worksheets that we will be using for data collection is this data sheet, which involves the program, which is like washing dishes, brushing teeth, washing hands, and then there's a prompt key, which is full verbal prompts, partial verbal prompts, model, partial model, full physical, partial physical. Each trial will be denoted with a check, a V, a PV, an M, a PM, a P, and a PP. This is the frequency behavior chart. This is just like how often a behavior occurs during a day, and you chart it. And then it's also another frequency chart which designates how many times a behavior happens from one time to another. And this is a functional assessment of behavior structured interview, which is pretty much lets the person know what the problematic behavior is, how often does it occur, what motivates the behavior, with whom does it occur most frequently, in what setting, during what time of day, during what task or activities, and during what task or activities. This just helps the educator keep track of what is going on with the behavior.
How will the ABA method benefit students? Improvement in the student's social behavior. Students are able to learn new skills. They can reach many students across the various levels of the autistic spectrum, and it modifies the learning environment according to the student's problematic behavior. Why is it important for educators to learn about the ABA method? It helps educators cope with difficult behaviors in an academic environment. It helps educators better understand a student's behavior and assess his behavior and focus on minimizing it. It helps break stereotypes and misconceptions of autistic students, and it helps educators commit.
Hope you enjoyed our presentation and understood what is autism and the teaching methods that you could use to teach students with autism. If you have any questions or comments, please write them below on our YouTube video. Thanks guys, have a great day.